Hey guys, it's me, Professor D. If you're new, welcome to my channel. Today I want to go over diabetes. I'm going to be doing questions and answers and going over rationales. So let's get into it. So number one, you're preparing to review a teaching plan for a client with type 2 diabetes mellitus. To determine the patient's level of compliance with his prescribed diabetic regimen, which value would you be sure to review? 1, fasting glucose level. 2, oral glucose tolerance test results. 3, glycosylated hemoglobin A1C level. Or 4, finger stick glucose finding for 24 hours. I'll give you guys a second to think about the answer. And the correct answer is 3, glycosylated hemoglobin level. That is what's also known as a hemoglobin A1C. Let me explain this to you. If you want to find out if a patient's been compliant, if they've really been eating the way that they said they've been eating, if they've really been dieting the way they said they've been dieting, guess what? That hemoglobin A1C, that's your key. Why? Because that gives you a picture of how that patient's blood glucose levels have been doing over the past 3 months. 90 days, right? So what happens is, and the reason when you want to do that, when you want to check the patient's compliance, you want to do the hemoglobin A1C, also known as glycosylated hemoglobin. The reason you want to do that, like I said, it gives you a picture of what their blood sugars look like for the past 3 months. The reason you want to go with that instead of the fasting blood glucose level is because of this. Patients tend to eat really well and maybe work out a little bit harder when they know they have a doctor's visit coming up. So a week before they have to go to the doctor's, they're eating salads all day. They're working out twice a day for the whole week before it's time for a visit. So they'll come in, you check their glucose, the fasting glucose, and of course it's perfect, right? And so they're able to trick you. But with the hemoglobin A1C, they can't trick you because like I said, it gives you a picture of what their blood sugar looked like over the span of 3 months, okay? So number 2, a patient has newly diagnosed diabetes type 2. Which task should you delegate to a UAP? In this question, UAP is unlicensed assistive personnel. Here are your choices. 1, arranging a consult with a dietitian. 2, assessing the patient's insulin injection technique. 3, teaching the patient to use a glucometer to monitor glucose at home. Or 4, reminding the patient to check glucose levels before each meal. Now I'll give you a second to think about it. And the correct answer is 4. So let me explain something to you. Unlicensed assistive personnel in some states, they may be known as a CNA or a tech or PCT, whatever it is, they're not licensed, they're not a nurse. Guess what? They cannot teach, they cannot assess, right? They cannot give medications. So 1, 2, 3 would have been out because guess what? They can't arrange consults. No, let me tell you what unlicensed personnel can do, just so you know, because lots of questions, and I'm telling you, NCLEX, HESI, ATI, midterm final, if it's nursing, you're going to have priority in delegation, and you guys have to know that. So when it comes to people who are not licensed, what can they do? They can remind. That means the nurse teaches the patient, hey, you're supposed to do this, you're not supposed to do that. The unlicensed assistive personnel or the tech or the CNA, they can come behind the nurse and say, hey, Mr. Such and Such, don't forget, your nurse said you can do this, or your nurse said not to do that, or your nurse said, to drink more water. They can remind. What else can the unlicensed personnel do? So they can remind. They can transfer patients as long as the patient's stable, right? They can gather equipment, even blood medication. They can pick medication up from the pharmacy and bring it down to the floor because they're not giving the medication, they're just transferring it. They can transfer medication, they can transfer equipment, okay? They can take vital signs, okay? They can record and report. What does that mean? They can record the vital signs and they can report it to the not to the doctor, but to the nurse, Okay, they can do INOs, record and report. They can take a blood pressure, record and report. If it doesn't require critical thinking, the CNA, the unlicensed personnel, can do it. Okay, and I'll get into priority and delegation in another video, but I just kind of wanted to give you an idea. Number 3, nursing diagnosis for a patient with newly diagnosed diabetes is risk for injury related to sensory alterations. Which key points should you include in the teaching plan for this client? Select all that applies. Now, before I even go into the choices, you students tend to have a hard time with select all that applies. So let me try to make it a little bit easier for you. When you have a select all that applies question, you want to treat them as true or false, okay? And you're going to go through each choice and say to yourself, is that choice true? If it's true, I'm going to keep it. And if it's false. If it's false, I'm going to throw it out. Now, don't try to put 2 answers together, and if they're true together, then the answer is true. No, that's where you guys go wrong. You have to go one by one and see if your answer is true or false. So, number 1, clean and inspect your feet daily. That is true. Yes. Okay, because patients who are diabetic, they have what's called diabetic neuropathy or